It's important to, while you're drying, to also rub kind of vigorously because that stimulates the breathing and everything. Graduate medical education refers to anything that happens after medical school. So for example, when you're a fourth-year medical student, that's when they decide what specialty they want to go into, be it pediatrics or family medicine or surgery. They then will apply for a residency program in their core specialty, internal medicine, peds, family medicine, surgery, for example. And then if they want to further subspecialize, they'll apply for a fellowship. It's really important because you want a physician who is at the top of their specialty, who has been well-trained, under good supervision, who's up to date with the latest evidence and research, and really has a chance to hone their skills. And that's what graduate medical education is. While the baby is sucking. Hi, I'm Dr. Buenconsejo-Lum. I'm the Director of Graduate Medical Education here at the John A. Burns School of Medicine. Okay, great. So today we're going to teach you folks, get you ready for your PEDS rotation. At the John A. Burns School of Medicine, we support 19 graduate medical education programs, and for reference, there's actually over 70 different types of specialties. So because Hawaii is small, we don't have the capacity or the patience to support everything, but we do support things like our primary care programs in family medicine, internal medicine, pediatrics, OBGYN. Our newest one is actually addiction medicine because this is a very high need area for our population here in Hawaii, and we want to train physicians to be able to treat that population. Listening to the baby is also really important, so you can get your stethoscopes on. The training program really includes a variety of methods, and so certainly the bulk of the training is clinical, so at the patient's bedside, but for certain areas and procedures and other things, we want them to actually practice in a safe environment, so that's where training with simulation and mannequins come in. Another part of GME training, though, is actual classroom academic, lectures and case presentations and whatnot. That's really important. So how would you approach it? As part of graduate medical education, we know that we have a workforce shortage really throughout the state, and especially in our rural neighbor islands. And so there's several strategies to help alleviate that shortage. One is to actually increase training sites in the neighbor islands. And so we do have our family medicine residency program, do a portion of their training on the neighbor islands. Our OBGYN residents just started in Hilo. And we know that when you have those training experiences, they're more likely to fall in love with the neighbor island communities, really get involved and be more likely to stay. If we can train them here for medical school and train them here for residency, then we actually have about an 80% success rate of keeping them in Hawaii. And so that's really important. Again, homegrown, who's going to be most familiar with our community. And to be a physician, there's so many pressures and challenges. You really have to have an aloha for the community and for the people that you serve. And so who better than our students?
Brought to you by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Advanced medical services haven't always been available on the west side of Oahu, and now the University Health Partners of Hawaii has partnered with Queens West, providing top-notch facilities and care to residents on this side.
The Queens West Hospital has been open for 5 years, and prior to then, the hospital had been closed. So since its opening, it's been a great addition to the community. There was no acute care hospital, and so it's been a huge deal for the patients in the area to have somewhere to go and not necessarily be transferred out of their local community. We offer an abundance of service for all the patients out here, not only general surgery services that we will see, but also cancer services and other ancillary services and departments are available out here for the patients. Currently, the hospital has 80 beds, and by the early next year, there's going to be additional 24 inpatient beds for patients. There's many services that are expanding, including the orthopedic clinic, rehab services, and other ENT services, along with surgical services. Hi, I'm Christina Wai. I am a surgical oncologist at the University Health Partners of Hawaii and an assistant professor at the John A. Burns School of Medicine. I'm one of the few board-certified surgical oncologists in Hawaii and with the John A. Burns School of Medicine. What that basically means is I'm a surgeon that deals with cancer. And so my specific focus is I see gastrointestinal cancers. This may include pancreas cancer, colorectal cancer, gastric cancers, and I also deal with skin and soft tissue cancers such as sarcomas. In terms of surgical treatments, we do our best to keep all the patients in the local community. Sometimes if they're very complex cases that need multiple teams of surgeons, then they may have to be done downtown. However, for the most part, a lot of the cancers can be treated locally and most of the care can be done here. For patients, not having to travel far is a huge deal. And being close to home is always great because it also allows family that may be working to come visit them more easily. Even though we're in the West Side, we're still part of the Queens system, so we have all the resources of the whole Queens Medical Center that provides us with a lot of resources, and so it's great for patients that even though some of the stuff can't be done here, the majority of it can be done locally. We are accepting new patients. Myself and my partners, we cover the gamut of general surgery and surgical oncology services. The University Health Partners of Hawaii Surgical Practice has multiple locations. One is downtown at the Queens Medical Center, one at Kuakini, and one right here in West in Eva Beach. For more information regarding the physicians and the medical services available, you can visit the UHP website at uhphawaii.org, or for more information regarding the Queens Medical Center, you can go to queens.org and has more information regarding the hospital.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Visit HiNowDaily.com for more information, and don't forget to follow us at Hi Now Daily on Facebook, Twitter, and Instagram.